So you came to see me last week at the
Yes.
first treatment. So how did you feel before the first treatment?
Before the first treatment, I was debilitatingly depressed and suicidal. You know, I'm looking for a job and trying to navigate my way through, you know, getting close to 40. And I was pretty depressed. I was also having pretty severe stomach pains here. Well, not stomach pains, but pains here. So I thought, you know, Carolina was telling me about you, and you know, I just thought I'd give it a chance. I don't like taking drugs. I don't like to take any of that stuff.
Because you only cover the symptom. You never treat why you're depressed.
Yeah.
And why you're depressed had to do with all the different events that cause blockages.
Yes.
Mind, body blockages, different area. That's the disease itself. Okay, bipolar, ADHD, depression, schizophrenia. Those are all names that Western doctors use to describe the symptom. Okay, the blockages. Okay, I don't care what you call it, as I demonstrate to you today. So, but anyway, so you look very, very bad. But after the first treatment, you look better. So,
Yeah.
how do you feel?
After the first treatment, I felt pretty good.
No depression?
No depression. I mean, it was I could feel it lingering in the background a little bit, but I had a better attitude.
But you only have one treatment. See?
And only one treatment.
And you had that for decades. The problem.
Yeah.
Yeah.
And you know, I think it was pretty strong for about 4, almost 5 days.
The relief.
The relief, yeah.
Okay, yeah.
And it was, I mean.
The reason why you cannot have complete relief is because I cannot give you 100 injections.
Yeah.
And then you be one sore ball and you
it'd be very sore.
Yeah, okay. So anyway, so the problem came back after the 5 days or so?
Yeah.
Okay.
And it came back.
Because
slowly built a little bit.
Because you worry about your jobs.
Yes.
Okay.
Yes.
And you're still smoking. Okay.
Yes.
You did try to improve on your diet, which is very good.
And I quit coffee.
Quit coffee, yeah, excellent.
So that's no coffee and no sugar.
Yeah.
In the coffee.
I told you have sugar a problem, okay?
Yeah.
And the smoking also a problem.
Yes, absolutely. Right. I agree with that 1,000%.
Right. Okay. So today you came in, you didn't look so good because your problem came back. Tell us what happened.
You know, I think as you explained it, the blockages still needed clearing. The traffic jam was still there a little bit.
Today you have a lot of problem by your abdominal area, by your liver area.
Yes.
Okay. And that is like frustration and worry, the spleen area. Okay.
Yeah.
And I told you very easy to get rid of it. Although you didn't believe me because you were feeling so bad. So how do you feel now?
I mean, I feel better.
Better, right?
Yeah, I feel way better.
Do you feel depressed now?
No, I want to be optimistic. You know, I want to have.
But you don't really feel depressed like you did before, right?
Not as bad as when I walked in the door today. Definitely not as bad.
Yeah, you see, look at your smile. And
you get a little better every time.
Your eyes also brighten.
Yeah.
Okay. Anyway, so what I'm telling you is that a chronic problem usually takes a little while, but improvement, dramatic improvement every single time is not easy to find a practitioner that can do that. But anyway, I don't remember what I did for you. So can you tell us how long ago was it that I treated you?
It was like 2006, 2007.
Okay.
And
that's like 8 years ago.
Yeah, it was a while.
Which is why she said I had to see you.
Yes.
You fixed her.
No one else. I went to
Doctor,
11 doctors before you.
Okay,
11.
So 11 doctors.
And nobody could. My period stopped.
Oh, okay.
And wouldn't come back. And
young woman in her early 30s.
Yeah.
Yeah.
And you know that, and then I had skin problems. My skin was terrible. I was very anxious.
Looks very good right now. Yeah.
Thanks.
Yeah.
And
Anxious,
hair, skin, hormonal imbalance, basically. And
those are effects. Those are symptoms.
Yeah.
Blockages are the disease. Yeah.
And so I came to you for about 6 to 8 sessions. I want to say it was 6 to, I can't remember, but it was around 6 to 8 sessions. You recommended 10. I came to you about 6 to 8 times, and all I can say is my period was regular from that point on, and my skin was way better. It took a few sessions for it to, but I remember leaving the first time, and I already, felt a little bit better.
Yeah, most people feel better the very first time.
Yeah. I mean, there's something,
Yeah.
But it did take a few. it took a few visits for the period to come back, and it was just like clockwork. Now, I mean, I can't explain it,
Good.
you know.
And you're happy, not anxious.
No, I still get anxious, and I still
okay.
get depressed. But I haven't been to you in.
You
8 years.
need a tune-up.
Yeah, I need to tune up.
You need to tune up, yeah,
I
exactly.
need
yeah,
to tune
yeah.
up, but it was to me like a miracle, honestly. Because doctors were saying, you know, there's nothing wrong with you. Some were saying it's perfectly fine to not get a period,
Oh,
which
That's
Not at your age.
is not normal.
not at your age, yeah.
Right.
Yeah, mm.
So yeah,
Okay,
so very
you
impressive.
can go to 1,100 doctors and still won't get anywhere.
Yeah.
Especially the conventional doctor who use drug or surgery.
Yeah.
Because the blockage had to do with the energy from your mind, the Chinese call qi. So if they don't know anything about a
Oh,
person being a spirit, then they can never kill you. Yeah.
because you got me off You got me off. I remember two things you did that were major. You got me off the pill, birth control pill.
Yes.
And you were very, very, you know, you really emphasized me not taking them. And then the other thing is I was taking glucophage medication. I was not a diabetic.
Oh.
I am not a diabetic. I've never been. But I was, you know, prescribed that for my hormonal thing for years. And you
Yes.
said there's no reason you should be taking this. So those are two things that I stopped taking.
No good.
And
Okay.
haven't taken since.
Number one, the birth control pill ruins your hormone.
Yeah.
They are not the hormone the body uses.
Yeah.
They increase the chance of getting cancer.
Oh,
Breast
Yeah.
cancer, cervical cancer, and what we take birth control pills and all the pesticides, they act like estrogen. They're called
Yeah.
xenoestrogens, okay?
Wow.
So that's why so many people in this country, breast cancer, cervical cancer, female cancer, that's the reason.
Ah.
The second one, glucophage. All the things that you treat diabetes increase the chance of getting heart disease 200 to 300 times.
Oh, Lord.
Wow.
There one study back in the 70s, and they had to shorten it 6 years, supposed to go for 14 years. They shortened it because they were killing people 200 to 300 times.
My God.
But doctors keep using it.
Yeah.
And then 30 years later, they changed the name of the study. They did the same study, repeated. They found the same thing, and doctors continue to prescribe it.
Yeah.
It's a useless waste of time to do
criminal.
all this study
Yeah.
and keep killing people 200-300 times.
Yeah.
As
Yeah.
many.
Yeah.
Anyway, so when you come back next time, okay, we will change some service, come back next time and see how you do.
Yeah.
I don't believe you're going to have a bad episode now because I cleared some really tight flaws. Okay?
Yeah, I
Great.
feel a little different now.
Yeah.
Better.
Use heat. Use heat.
Sore from the injections,
Yeah,
but
use
that
heat.
goes away.
Yeah, exactly.
Yeah.
Good.
Yeah.
I did have a question actually
sure.
related to history. He's taking a lot of acid reflux medication.
No,
That's
me too.
that's what my doctor thought this
Yeah.
was.
No,
And-
yeah. So next time I'll release it.
Yeah, because
So easy.
I read that what were we reading? That it
No
causes
good.
B12 deficiency.
Yeah, it causes
Yeah,
B12
yeah.
deficiencies.
You know, most acid, when you interfere with the body function, no good.
Oh.
You want to restore its independent
it's
function.
natural.
Yeah, the function get ruined is because of blockage.
Yeah.
The qi is what you need for function. When the body die, what do you lose? No DNA, no stem cell, no molecules. You lose connection to your soul. You are a soul. So the source of the qi. Qi is needed for every single function. So when I open your pancreatic freeway, your pancreas get qi, you can function. When I open this area, then you don't, the sphincter can close and then you don't get, so everything is opening the blockage, opening the traffic jam.
Yeah.
So don't
Yeah.
take drugs.
Yeah.
Take not just vitamins are not good either. Vitamin is you gotta take food that contain vitamin.
Oh.
Yes.
Whole
Natural.
food supplement
No vitamin.
that have qi.
Okay.
Okay.
Yeah.
The vitamin if you work, it doesn't work as good as whole food supplement.
Yeah.
Okay.
Yeah, the natural way.
Great.
It's better.
Thanks very much
Yeah.
for sharing your story. Okay.
Thank you.
So I think you're going to be happy for the whole week. I really believe.
Yeah, 7 days.
Okay. Good.
Go
All right.
for it.
Okay.